Hello everybody, I am Dr. Bagirath Raghuraman, working as Senior Consultant Cardiologist and Program Director of Heart Transplant at Narayana Health City, Bengaluru. Aortic stenosis is a condition wherein there is obstruction of the aortic valve, and oftentimes the left ventricle is unable to pump because the aortic valve is narrowed so much that it is unable to support the circulation. Basically, these patients present with signs and symptoms wherein there is insufficiency to the entire circulatory tree. Now, these patients can present with chest pain, they can present with breathlessness, or in more serious valvular obstruction, these patients can actually present with syncope, meaning that they tend to fall unconscious if they exert a little more than what they do. The treatment of aortic stenosis is basically replacement of the narrowed aortic valve. From time immemorial, the treatment has always been surgery, wherein it started off with an open heart surgery, and then now it has come to a minimal access wherein surgically the surgeon is able to implant the aortic valve through a minimal access approach. In those patients who are elderly, who are sick, who have a very complicated comorbid condition wherein they have multiple other problems which increases the risk of surgery, we now have a condition or a form of treatment called as TAVI, that is trans-aortic valve implantation, transcatheter aortic valve implantation, wherein by a catheter we can replace the stenosed or narrowed aortic valve. Now this is, again, there are various approaches, the commonest approach being through the groins, and then the valve can be successfully replaced, and these patients can recover in a timeline of 2 to 3 days and be discharged and resume their day-to-day activities. This form of treatment is extremely helpful for those patients who are very elderly, sick, and wherein the risk of surgery is very high. In these form of patients, this procedure comes as a big hope to continue survival and to give them a good quality of life.